everyone, and welcome to Asian Viewpoints with marysit. Did you know that 1 out of 3 men and women will receive the dreaded diagnosis of cancer in their lifetime? And if you or your loved one has ever received that, you know how terrifying the C word can be. Well, our guest today is Jila Tanha. She's a senior health educator with almost 2 decades of experience working at a major nonprofit global cancer center. Jila, thank you so much for being with us.
Thank you so much for having me, Mary.
Jila, in your role, you deal with these difficult conversations all the time. Tell me, what is it like when someone first gets this diagnosis? Are they just overwhelmed? And how do you help as an educator?
Well, it varies, Mary, because everybody receives the information and processes it differently. But like you said, receiving a cancer diagnosis, it is overwhelming no matter what, no matter how much you know about cancer or you don't know about cancer. It does not matter. Like,
Mhm.
a lot of people think like, oh, because people are doctors or nurses or work in the healthcare field, they can handle it better. No, that's not true, because it's just the first time that people hear that you have a diagnosis of cancer, immediately what comes to mind is I'm dying.
Mhm.
And there's a stigma
Right.
attached to that word cancer still up to this day and
Still.
age. But what how I approach it is like, first step is to listen
Mhm.
and see what their needs are.
Mhm.
As a health educator, listening is the first part. Communication, communication, communication. That is important in any relationship, and
Right.
especially in healthcare relationship, and bringing the information to patients or their caregivers. It is so important to understand how much they know, what
Mhm.
they want to know.
Are people less fearful the more information they have when they understand what's going on? They can grasp the treatment options. Are they usually less afraid then?
I think information is giving people sort of like a empowerment,
Mhm.
that they think like, okay, I know more. I can have a better conversation with my healthcare team,
Mhm.
even though they went to school for many years and they're experts in the field, and they are
Right.
going to be delivering the treatment. However, we always tell patients that you are on top of your healthcare team. You're leading your healthcare team. So you have to, and patients, yeah, when they understand the disease better and what options are there, they can ask better questions, and they get involved within the process of
Mhm.
getting the treatment, and outcome of the treatment is going to be better. That is proven by a lot of research.
How do you steer someone from taking a deep dive into a rabbit hole? You know what I mean, on Google, and you go on and on and on and on, and maybe their issue is sort of like up here, but they're going way down here, and without discouraging them from doing their own research and taking control right of their health journey. How do you encourage them to read the right resources that are scientific and accurate and true and related to their condition?
That's a great question, especially nowadays with ChatGPT, AI,
Mhm.
everybody's hand, if you will, like in the palm of their hand. Everybody goes to Google, Dr. Google, and of course,
Mhm.
Dr. Google, now run by AI, provides some information. We're not saying that those informations are not good, but it's just like how people can vet the information and make sure that the information that they are basically receiving or researching and searching and finding are accurate and reliable. And that's what the role of a health educator is.
You've also worked as a patient advocate, right? Where you advocate for that patient. Let's say someone doesn't really have an assigned patient advocate or access to someone like you. How can someone's family member be that good advocate? Or if you have a friend who's going through, or loved one going through cancer, how can that person be a really strong advocate, an effective advocate?
Absolutely. And every patient has the right to to receiving correct information and
Mhm.
the information that are reliable and related to their care. And
Mhm.
they can involve their loved ones as an advocate for themselves. They can provide proxy. This is something that a lot of people don't know. And all the hospitals, especially hospitals, you can have proxy with my chart. If most of the hospitals now, that they have the EHR,
Mhm.
electronic health records, electronic medical records, and different names for it, but it's the same thing. And you can, as a patient, everybody can assign a proxy or as many proxy as they want.
Jila, let's talk about advanced planning. What's involved with advanced planning, and does everyone need to do this?
I personally encourage everybody ages 18 and up to think about it, uh, make make decision about it, and then get it done, and then talk to your loved one about it. So basically, advanced care planning entails two documents. And one is called medical power of attorney, and one is living will.
Okay.
And most states, all states require these two documents. Like if somebody is in a state that they cannot talk on their behalf, it's not just for terminal illness. That's what I encourage everybody to get it done, because we live in Houston. Driving is crazy. Get into an accident, and we cannot maybe talk on our own for a few days, but they need to do a surgery on us. Do they know? Somebody has to make that decision. So medical power of attorney, you're giving someone proxy, and there are different names used for
Okay.
it, but it's the same thing. You can give someone proxy to make decisions for you when you cannot
Okay.
talk.
And the living will is basically the document that tells you whether it's okay to pull the plug or do everything extraordinary, keep me alive, right? Something like that. Yeah.
Basically, it's a legal document that you can prepare and make decision again, because that's for end of life.
Right.
For, at end of life, there's so many treatment options or symptom management options are
Mhm.
available, and living will, putting it together, helps again your surrogate, your loved one, whoever makes the decision for you, and your healthcare team, to make it easier for them and for you.
Okay, let's switch topics a little bit to something a little more cheerful, laughter yoga or laughing yoga. I understand you are a certified instructor and trainer, all of this. First of all, what is laughter yoga?
Oh my gosh, it's a wonderful tool, if you will, if nothing else, wonderful tool that everybody needs to just put it in their toolbox of living life. We forget to laugh
Uh-huh.
day to day, especially when as we go through life and growing up, life becomes serious, correct?
Mhm. Mhm.
Just if you look outside when a bunch of kids are playing, just watch them for 5 minutes, 10 minutes, and see how much they're enjoying chasing each other. And we all remember when we played the game of tag, correct?
Right,
You're
right.
it. And just you're it prompt us to just run after each other and just laugh when somebody
Mhm.
was it, correct? So that's the power of laughter. Just brings happiness, even though it might be for that duration, 1 minute, 5 minutes, 10 minutes, but that stimulates the good hormones that we all need in this day-to-day stressful day-to-day life.
Okay, Gila, let me ask you this. We know that laughter is good for you. Laughter is good, it's like medicine to the soul, right? We know that yoga is good for you. But what is it about the combination of combining yoga and laughter together, and what benefits or unique benefits does that combination bring?
Absolutely. And what laughter yoga is about is basically movement and laughter, which is like, it starts with the fake laughter in the
Right.
beginning, and it becomes real. It just, then we can, when you experience that laughter yoga, you feel like, wow, this is the power. Because when we breathe in yoga
Mhm.
practice, yoga is, the essence of yoga is about breath
Okay.
and breathing. It's
Okay.
not about the contortions and all
It's
those.
just the poses and all that. Okay.
It's because when you breathe and you focus on like the movement and a
Uh-huh.
stretch, then you see the power of both movement and breath. So
Okay.
laughter yoga adds the laughter into the movement and the stretches and the breath. They,
Okay, can you demonstrate laughter yoga to me? Like, give me a little 15-second thing.
yeah, so it's a process. It starts with like, it's okay, let's do this.
Okay.
It's
I'll
it's
be your student.
Yeah. Okay. So we just pretend like, pretend you're on the phone.
Okay.
Okay. And we don't use words. We just like, childlike playfulness. So you
Okay.
pretend that you have a funny friend. I hope you do. I do have
Uh-huh.
a funny friend. You pretend that you're talking to your funny friend. Your funny friend just cracked up the funniest joke ever. You can
Okay.
just imagine whatever joke you want the joke to
Okay.
be. And then you let out the laughter, and it goes like, and we both just showing each other, not talking, with laughter.
Okay. So
How
we're
do
sort of faking it at the beginning, like we're acting, but then it becomes real because it's so funny that we're laughing like that.
Yes,
And then at the
exactly.
end, we sort of feel good. Is that
Yeah.
right?
Yes. And it's more into it because this was just a virtual. I didn't go into like, you start with some very small
Mhm.
exercises in the beginning. We call it exercises in the beginning,
Uh-huh.
clapping, chanting. So when you do clap and chant, you stimulate your all the acupressure points with clapping, and with chanting, you open up your lungs.
Uh-huh.
And it's ho ho ha ha ha, and the laughter too. When you laugh, and the deep belly laughter, all the organs are going to be involved. And you feel like people say this is the aerobic exercise.
Jila, thank you so much for being with us. Appreciate your time.
Thank you. Thank you, Mary. Thanks for all that you do. I appreciate having me here today.
Thank you. If you enjoyed this video, please click the like button below and be sure to subscribe to the station. And I'll see you again in the next video. Thanks for watching.